Welcome back to Ozarks Tonight. November is Lung Cancer Awareness Month. The American Cancer Society estimates more than 228,000 new cases of lung cancer will be reported this year, and more than 142,000 people will die from it. Tonight, we are learning more about lung cancer, prevention efforts, and tobacco-related policies and proposed legislation in the country and in the state of Missouri. Emily Kalmer is here with us. She is the Government Relations Director for ACS-CAN, the American Cancer Society Cancer Action Network. Emily, thank you so much for being here.
Thank you for having us.
So at the state level, looking at those numbers, it's crazy to think about and thinking about something that can be prevented for some people in some cases. At the state level, what specifically are you working on right now? What is your priority?
Sure. Well, unfortunately, Missouri lags behind the rest of the country in how much we invest in tobacco prevention and cessation funding. We know that good programming and providing cessation resources can really help adults that are trying to quit and prevent kids from starting using tobacco. So we're going to be focusing on advocating for more funding for tobacco prevention and cessation.
So those programs, what exactly does that look like for youth? Does it mean going into schools and giving presentations, talking to them about the dangers, and what does it look like for adults?
Sure. Well, right now, the only funding that the state appropriates money for at the state level is the tobacco quit line, which is 1-800-QUIT-NOW. And if you're someone who's struggling with tobacco use and you want to try to quit smoking, for instance, you can call that number and get connected to a counselor who will help you with some tips to start your plan to quit. And then also, depending on whether it's appropriate or not, they can provide you some nicotine replacement therapy. So that's the only funding right now the state spends money on of state funds for tobacco prevention and cessation.
So there is no funding for any youth programs, for example in schools?
Right. There's a little bit of funding from the federal government that they use. For instance, recently the governor announced they were going to do some advertisement about the e-cigarette use, but there's no state funding right now for youth use in the state budget.
Is that surprising to you that we don't have anything like that for the state of Missouri?
It's unfortunate. As I said, it's something that we really need to change. If we want to prioritize the health care of our kids, we need to invest in the proven interventions that help stop them from smoking when they're young, which is when most people start.
And when you go up to Jeff City and you talk to legislators about your policies and your plan, what are you asking for? What does your programming look like when you say, this is what we need funding for?
Well, first of all, on the quit line, unfortunately, some years the quit line runs out of tobacco nicotine replacement therapy. And so we have folks we know that want to quit smoking and call the quit line, and we aren't able to connect them with all of the resources that we know help them stop. So we want to make sure that there's enough funding for that so that anyone that wants to quit really can, start that journey with all the resources at their disposal. On the youth side, we know there's some programs that are really good at explaining them the dangers of tobacco use, and those can really make an impact. So we'd like to help train folks to be able to provide that programming throughout the state. I know here in the Springfield area, the health department has been able to work with the schools, and there's been a little bit of training going on, but unfortunately that's not the case statewide. So we really do want to make sure that we can get some of that programming out to the schools. You do need resources to quit an addiction, just like the other addictions that, drug use, tobacco use is really an addiction. So we want to help people with that when they have that going on.
So with the session, what do you have planned right now? I know you guys make trips up to Jeff City. What do you have planned? What is the next step?
Well, with the budget process, that starts pretty early. So we at the American Cancer Society Cancer Action Network, we help people who've been impacted by cancer share their experiences with lawmakers to drive change. So we're always looking for people that are impacted by tobacco use. Maybe someone who's gone through a lung cancer experience or had been a caregiver for someone who had lung cancer, and we have those people who really want to have something good come out of their experience share their stories with lawmakers. So if any of your viewers want to participate in this, they can go to www.fightcancer.org and get some more information about how they can connect with their lawmakers on this issue.
Okay, great. What would you say is the biggest challenge you have? This is obviously not something new. You have been doing this for years, and still in Missouri, you're still looking for that funding for these efforts and these programs. What is your number one challenge when you do go up to Jeff City and you talk to legislators about, here's what we need, here's what we want?
I think there's so many competing priorities for legislators that when they don't hear from their constituents, they don't know what they should be investing the state's resources in. So in this case, there's a lot of other things that come before them, and we want to really make sure that they view this as a priority. The health of Missourians and the prevention of cancer is something that needs to be a priority, not just trying to treat it on the back end.
Emily Kalmer with ACS CAN, and that website again is fightcancer.org, correct?
Yes.
Yes.
Thank you. Yeah.
Thanks for being here.
Thank you for having me.
And we will have that website and all of the information we talked about here on Ozarks Tonight on our website, and that is ozarksfirst.com. We'll be right back.